doing our homework. We are working in state issues related to co-benefits in relation to the transport sector, to the housing sector, to the agriculture sector. But today I am not going to focus on what we are doing in California, which I will love, but I am going to focus on issues that are affecting millions of people in Africa, poor people that are undernourished and suffering the consequences of the droughts in the Horn of Africa. Then I am going to focus on nutrition-sensitive mitigation and adaptation strategies. Probably you have seen this graph ad libitum, but I just wanted to point it out that with high confidence, the largest arrow has been always the arrow that stressed that the main health impact is on malnutrition and consequent disorders, and these consequent disorders are related to children development problems and stunting and retarded growth. Still, I was looking at the declaration that the group of the Health Summit is going to sign, and I would like to add these issues, health and nutrition, go very closely, particularly in Africa, where there is a huge epidemic of AIDS, and we fail in putting them together. The human face of climate change is this one. Right now, oops, I'm sorry. Right now, almost a billion people are suffering from hunger, long-term hunger, chronic exposure to micronutrients deficiency. But the problem is that despite all the commitments that we have with the Millennium Development Goals, by 2080, we expect not to reduce this level of undernutrition, but to be still around 200 or 600 million people hungry. That depends on the different models of the IPCC. And we don't have better news with water. It will be still, we are thinking that by 2080, there may be from 1 to 3 billion of people that have water scarcity. And the point is that climate change exacerbates nutrition in different ways and in ways that people have not been framing and analyzing in the appropriate way. All the models that have been used so far are using as an indicator just stunting, because it's the data, it's a data that is available from many countries, which indicates chronic exposure to malnutrition. And there is another indicator that is wasting, that indicates response to extreme conditions during when the people are in the move, when they have to go to refugee camps, etc. But those are the only two indicators that we have available. And the models have been really looking into food security, and after the IFPRI, for example, IFPRI, the impact model is who has been modeling the impact of climate change into food security. They have developed an algorithm after that is very interesting, using parameters like women education, girls education, and ratio to men to women in a household. Interesting parameters, but still they have not been able to calculate very well how climate change impacts malnutrition. And we have been proposing a model that is a start, but it makes the issue more integrated. We are trying to look at the climate impacts and variability into three components that are a determinant of children and women malnutrition, which are household food access, maternal and child care, which refers to breastfeeding and feeding practices and community practices to take care of recent mother or pregnant mother. And the third one focuses on environmental health and on health access. Then we can see that there are different estimations of what we are going to see in the future, but again, a very nice study of IFPRI, they estimate that calorie availability in 2050 is likely to decline through the developing world, resulting in a 25% more undernourished children than in a situation with no climate change. Last year, I wanted to mention that this is affecting particularly sub-Saharan Africa. Those are data from malnourished children in sub-Saharan Africa. And there exactly is the point where we have to start to put things together in between health, the epidemic of AIDS and nutrition, because here in the convention, they are just talking about food security. They don't care the kind of people, of food or diversity of food you are producing. It's just food security. Then there are many properties of food that may delay the start of AIDS that have to be in consideration, particularly in Africa. The last year we prepared, I am the moderator of the UN Standing Committee of Nutrition Working Group on Climate Change and Nutrition, and we prepared a document that was distributed to all the delegates, giving them very down-to-earth practical recommendations on how to influence the agenda. We were going through practical ways of how they could insert nutrition issues in the negotiated text. Now, this year, we are launching, tonight I have some copies here, a paper that is a little bit more down to earth. It's for communities, it's for countries to incorporate issues related to health and nutrition through women leadership in their adaptation action plans. And I don't know if you are familiar with this assessment of UNEP last year, that they were saying that towards, we are going to be 9 million of people by 2050, and that the taste of the Western diets in meat and dairy products were unsustainable. And they went further. They were asking for a global shift towards a vegan diet. That puts a scream around. You cannot imagine. It was still, when I saw this slide in UCLA, my students get upset. But anyway, it's a way of communicating. These things have to be communicated in a good way. There is a very interesting way on how the same concept has been communicated in FAO for developing countries, and that is passing the message to also industrialized countries. And it's the concept of sustainable diets and all the co-benefits that they bring. Sustainable diets are diets that have low emissions. They are produced with agricultural practices that have low emissions, climate smart agriculture, integrated agroforestry, but at the same time they are healthy diets that usually are local, that protect biodiversity, that are good for indigenous populations, that want to keep their medicines, natural medicines, and many wild plants that have many micronutrients and vitamins that are critical and essential. At the same time, sustainable diets are socially equitable because they provide food. For example, I don't know if you are familiar with what they are talking right now here in Africa. There are foods that are foods for men and foods for women. Women produce 80% of all the food that is consumed in the world, and they produce different foods or agricultural products than men. And it's very funny that they have this differentiation, but it's important that this type of crops, if they are feeding 80% of the people that consume them, are adequate for their needs. Then sustainable diets is a way to communicate, and that is being quite effective. We have been doing, my institute is doing a lot of studies on communicating on co-benefits, and this has been one of the stars. In Sweden, well, in Sweden you can communicate everything in Sweden. I mean, it's like if you read what they have done, they have changed totally the dietary recommendations, the Swedish National Food Administration, and it is unbelievable. I mean, they are recommending it, reducing the portion size of meat, eating locally produced and grass-fed animals, choosing seafood with sustainable eco-labels. They go for fruits and vegetables, choose the ones that are seasonal and locally produced. They don't impose organic agriculture because they don't want to impose. That's great. They talk about pesticide-free. They are promoting locally grown and reduced rice intake because in Europe, for example, it's always imported and has high emissions of methane. And same thing with recommendations for cooking fat. They look into less saturated oils, and they have recommendations also for water. Forget the bottles. Drink tap water. Then you would like to go to Sweden and stay there. It's amazing. Anyway, another issue that really has an impact on children malnutrition has been the rapid, explosive biofuel expansion. These are, again, models from IFPRI, and you can see that the differences between a very rapid biofuel expansion in SSA, sub-Saharan Africa, and rapid expansion in South Asia, and may have a much bigger impact on children malnutrition that a more regular biofuel expansion. Then what we are looking is in trying to find how other ways of energy or bioenergy could be, at this problem. Yesterday I spent the whole day here in the Agriculture Day. We have been the Solely Voice talking about health and nutrition in the Agriculture Day for 3 years. I invite you to join. Yes? Okay, to join next year, but what we are trying to do is to promote nutrition and health promoting agriculture that can increase diversity and reduce emissions through issues related to agroecology, agroforestry, and proper bioenergy. And finally, yes, the last one, that in order to bring co-benefits, what now the EU group of ethics and science and technology in agriculture is recommended that instead of having just the typical health impact assessments and the environmental impact assessments that we have in the past, we do something more integrated and we include ethics and socioeconomic and fair trade issues. Thanks a lot.